Well, advancing age often comes with aches and pains, sometimes severe, and managing that pain safely is key to maintaining well-being.
In today's Cost of Caregiving, Jennifer Bisram takes a look at safe pain relief management and alternatives to opioids.
These were some of the meds that I was on during my knee surgery.
Just what the doctor ordered.
This was the Oxy.
Medication to manage pain.
It was very, very painful. There were nights where I was crying because I was in so much pain, and you get like almost delirious, like you just wanted to stop.
68-year-old Mary Ellen Lillis is recovering from knee surgery. Shedding light on her experience, she says the post-op pain was relentless.
I didn't know what to do with the pain because it was so intense. Oxycontin was one that was the one that I would take every 4 hours.
But from nausea to insomnia, she soon realized she couldn't tolerate the side effects from prescribed opioids.
I just felt like I was too not myself taking those meds, so I kind of like, after the first week, I was like, you know what, I'm gonna have to just deal with the pain. I know it's gonna hurt.
What are you taking for the pain now?
The ice machine, you know, definitely helped me tremendously.
While the New Jersey retiree chose a different road to recovery, it's not always ideal for people with aging ailments and surgery recovery.
It's an easy slope to slide down if the pills are comforting you and you're getting relief from it.
An alarming statistic, according to the CDC, it only takes 5 days for opioid dependency to set in. And deeply unsettling for the aging population in New Jersey, older adults recorded the highest number of suspected overdose deaths in 2025, more than any other age group, including teens and young adults. In New York City, over 700 adults older than 55 died of unintentional drug poisonings involving opioids in 2024.
Some of the most commonly prescribed opioids like oxycodone and hydrocodone, they are literally made from opium, and they have effects on the brain that are indistinguishable from heroin.
Dr. Andrew Kolodny is the president of Physicians for Responsible Opioid Prescribing and medical director for opioid policy research at Brandeis University.
Why are we still overprescribing opioids?
We have a healthcare system that incentivizes sort of getting patients out of your office quickly. And the quickest way to get a patient out of your office sometimes is to write them a prescription.
Geriatricians say the amount of older adults who died from falls have tripled within the last 3 decades, with 2/3 of the fatal falls linked to prescription pills. A study published by the Journal of the American Medical Association found in 2023, more than 41,000 seniors older than 65 died from falls.
How were you feeling when you were taking all of these at the same time?
I didn't feel good. That's the thing. I was nauseous. I was getting sick every morning.
Addiction awareness advocates recommend talking to your doctor about the medications you're using and trying opioid alternatives for pain management, including exercise, acupuncture, physical therapy, ice, over-the-counter medicine, and chiropractic care.
Whether you're 16 or 65, you still have the same kind of risk if you're prescribed an opiate.
Partnership for a Drug-Free New Jersey, which educates New Jerseyans about opioid risks, now has a statewide healthy aging and opioid alternative campaign.
As we talk about opiate safety, we also need to think about healthy aging and what it really means.
Turning to Mary Ellen, who dialed down opioids before she could become dependent on them.
I'm doing good. I mean, I'm still in pain.
She's been on a mission to forge a stronger joint, using the gym, physical therapy, walking, and baking to build a better knee.
When a doctor's reaching for their prescription pad or recommending a medication, they might want to ask that clinician, is there a non-medicine alternative?
Relief with less risk during the golden years. Jennifer Bisram, CBS News, New York.
Jennifer covers aging and caregiving. If you have a story idea for her, just scan the QR code on your screen.